Public health officials in this country throughout the pandemic have become a kind of public enemy number one, as opportunistic politicians and media have whipped up a familiar kind of backlash politics aimed at mask mandates and public health orders and directed all this rage on basically civil servants. It just happened again this week, St. Louis County, Missouri. After, again, weeks of rising COVID cases, public health officials there reinstated a mask mandate. Barely a day later, the county council met to discuss overturning that mandate and to hear from the crowd who packed into the room.
We've lost sight of the fact that people shed blood, their lives, their children, their mothers, their daughters, for us to have the freedom from tyranny.
Masks don't seem to work in that occasion, but masks do seem to sell fear.
Stand with me now with our voices in unison and put our public servants on notice that we will not now nor ever again allow our inalienable rights and constitutionally protected liberties be taken from us. We will give no more ground. We will not comply. We will not comply. We will not comply.
So that was the crowd in the room when one of the people behind the new mask mandate, St. Louis County Health Director Dr. Faisal Khan, stood up to address the council.
Community transmission of COVID-19 attributable to the Delta variant is now at an all-time high across the St. Louis region. Madam Chair, it is my duty to inform you on the record that if the council decides in its infinite wisdom to negate this public health order, there will be more misery, there will be more infection, there will be more death.
Are we talking about shutdowns again? Are we talking about sports going away? What's your next move if they continue to go up?
It is my duty to tell you, sir, that if the situation continues to worsen, all options will be on the table.
Oh. Okay, all right. Please. Please.
You can hear the crowd audibly reacting to Dr. Khan throughout the hearing. He says much of that heckling was racist, xenophobic, and threatening. In a letter to the council chair, Dr. Khan wrote, quote, "I heard people doing their impersonation of Apu, a caricature character from the Simpsons television show that mocks people from South Asia, such as myself." And Dr. Khan says as he got up to leave, "I became surrounded by the crowd in close quarters, where members of the crowd yelled at me, calling me a fat brown C-word and a brown bastard." Dr. Khan says he instinctively reacted by raising his middle finger to one of the hecklers who had physically threatened him. Just a few hours later, the county council voted 5-2 to rescind the mask mandate to the cheers of the crowd. And Dr. Faisal Khan, the director of the St. Louis County Department of Public Health, joins me now. Dr. Khan, thank you for joining me. First, I wonder if you could just tell us, what is your job as the county director of public health there in St. Louis County? What do you do and how long have you done it?
I've been Director of Public Health in St. Louis County for a total of 5 months. I have served in this position once previously for a period of 4.5 years, but I have spent the last 10 years with the St. Louis County Department of Public Health in a variety of positions, and the last 25 years in public health across the world.
What is the COVID situation right now like in your county?
It is going from bad to worse. As you mentioned, cases are on the rise. Pediatric admissions attributable to COVID are seeing a sharp increase in area hospitals. And I know from talking to our colleagues across the hospital systems in the St. Louis region that they are extremely worried as they see ICU beds filling up and a direct threat to the life of the very patients they seek to serve continue to increase unabated.
That was what drove you and I think the others in that the department to recommend this mask order. What was that room like to be in as you were there speaking to the county council?
So when I walked into the room, the first thing I noticed was that it was a capacity crowd. In fact, it was overflowing, and almost nobody was wearing a mask, which alarmed me as a public health professional, because what I could see before me was a potential super spreader event. It further horrified me to note that some people had children with them, and there were quite a few people in the audience that were older, in the 60, possibly older range. So it was not a good sight. And there was palpable anger building up in the audience well before the meeting. As I learned afterwards, there'd been some sort of political rally before the meeting. So people's worst fears, I think, had been preyed upon and exploited to get them fired up in anticipation of the conversation.
You write in the letter that there were two politicians who were sitting behind you, sort of berating you, trying to distract you. One of whom was Mark McCloskey, who viewers maybe remember as the guy who brandished the gun at the Black Lives Matter protesters, pleaded guilty in July to a misdemeanor. What were they saying to you?
You know, I couldn't make out everything, but it was a series of interruptions and staccato sentences designed to throw me off course every time I would begin to formulate a sentence or think through a response to a question. Something was yelled at me either from the right or the left. I couldn't obviously see who was saying it behind me precisely, but that is where the individuals were seated. And at one point in time, as you showed in the video, I actually turned around and asked somebody to please be quiet and let me finish.
There was also a really unnerving and disgusting amount of racial animus that was hurled towards you. Have you experienced that before in this position ever, and what was that like?
Not in the 25 years that I've spent in public health or the 10 years that I've worked in the Missouri Department, the St. Louis County Department of Public Health. This was truly unprecedented, and it wasn't the entire crowd. I think most of the people there are good and decent people. They would never even think about uttering a vile word to anyone, no matter how much we might disagree about wearing masks, etc. But once the collective temper and emotions of the entire audience have been dialed up all the way to 100 by provocations and what I would call dog whistle words, it's very difficult to return it to normal as soon as the conversation moves on to something else. It was ripe for spilling over and crossing boundaries, and that is exactly what happened. Some people in the audience took out their anger on me as I was leaving, and it was a very jarring and unpleasant experience.
Have you ever been in a room like that before?
I've been in plenty of heated conversations and tense meetings with the public. I mean, that's part of the nature of the work that we do as public officials. Our job is to explain facts and just stick to the truth and the evidence, whether somebody agrees with us or not. We absorb a lot of anger all the time, but I have never seen this sort of dynamic at work. It has always been a case of meetings being orderly and controlled from the dais, from the people chairing those meetings, because they understand the importance of careful deliberation based on an exchange of knowledge rather than allegations.
Dr. Faisal Khan, the acting public health director in St. Louis County, a state of Missouri that has quite a bad outbreak on its hands. He's doing his best to combat that, and I appreciate you taking time with us tonight.
Thank you, Chris. It's a pleasure.